So in India, polio at that time, I'm talking about 70s when I was in school, was quite evident. We saw them every day, but not realizing as a child what that meant because it was so common. First time I truly realized was as a medical student and an intern what polio meant, because we used to do some camps around our med school and small areas which we call polio camp. And one of my first memories was doing a polio camp and 400, 500 children outside our little hospital waiting to be treated, as we were the medical team from the medical college, medical school who had gone to treat them, to evaluate them. And it was probably one of my the sights which I'll never forget in my life, people walking on their four limbs and quite crippled with this disease, and their parents holding them and with hope in their eyes that this medical team has come, that they will make their child stand or walk again. What we see in this part of the world is what's called the post-polio syndrome. After 15 to 40 years of having polio, so those patients who had polio in 50s, 60s, I think in the United States, the last patient was in 70s. But again, I've heard case reports of like a focal here or there, but the documented was in early 70s. But some of these patients who had polio in the past, after 15, 40 years, they can have what's called a post-polio syndrome. They come back with increased muscle weakness and pain, and it's also related to their polio disease as a child or a teenager. So when I was in India, obviously the polio was still quite prevalent, and I think they have done a good job in terms of their oral vaccine, and as it is a very preventable disease, so I'm sure the incidence is quite low, at least in that part of the world now, but neighboring countries and neighboring around still is prevalent, what I've heard. I don't have the statistics, but when I was growing in India as a med student, the polio was all around us. We could see patients walking on the street, or obviously the lower socioeconomic being around the malls and the streets all the time. We don't see that here anymore. I would see some patients who would come to me for a hip or a knee replacement and would say that their other side, they had polio, they had weaknesses. Obviously, but it's not definitely seen on a day-to-day basis. I don't think. The students in the med school here, my daughter is a med school student, and I don't think she must have seen an acute polio patient in her career. But across the globe, it's still a problem. It's still definitely a problem, well identified by Rotary and the Gate Foundation and the UNICEF, which is doing absolutely wonderful job, because this is one of the diseases which can be eradicated. I think the last time they had success eradicating a disease was smallpox, and now the polio we're on the verge of eradication if we continue our vaccination program and obviously educate the rest of the world. But you have to see just one live patient with polio walking almost crippled, and the enigma and the emotion of the family taking care of that child, how disabling it is, and how mentally alert those children are. These are alert children with bad, crippling deformities, which is preventable. I think the message here is it's preventable, and it is a very disabling condition once it sets in. And if you could prevent it, it's just, these are children of between the age of 5 to 15 who are just walking on their four limbs, can't stand, have this gross deformities, could be just paraplegic or quadriplegic, meaning 4 or 2 limb paralysis. And if you look at them, and this is the youth which would then be prevented and could be normal, they could have been normal. They were not born like this. This is completely different from other neurological conditions like on cerebral palsy or some others which are not as preventable, but this is a completely preventable, disabling disease with the sequelae which are lifelong. And these are alert children who are very intelligent and can do so much, but are just prevented because of their limb deformities. First of all, it's a very, very disabling disease. It affects children more than adults, so they have a long life in front of them, and it's preventable. Just because it's not happening here, it's like why should you care about gun violence if it's not happening in my suburb? It affects everybody in the long run. The world is getting flat, and it's about humanity. It's about real people. And it's same as why one should care about poverty, why one should care about AIDS anymore, because these are real. These are real problems of the real world, and a lot of these are preventable. So I think to be honest, as you have to see just a couple children of polio to see how disabling it is and how big a problem it is. If you take the volume is huge around the world. It's huge. At the moment, it's only in the developing nations. The Western world has done very well with their vaccination program. But the key is to keep this program running. You get lax, this may come back. I think if we don't continue what we have done, it will come back because it's not eradicated yet from the world. I got excited when I saw this and about this flight for polio and against polio. I think this is a very noble cause. It is this is a disease which can be eradicated, and the problem is real. I do consider that supporting this program is supporting humanity. Truly, yes.